Feline lower urinary tract disease, FLUTD, describes a group of conditions that interfere with normal bladder and urethral function in cats. These issues can cause irritation, inflammation, or blockage of the lower urinary tract, leading to signs such as straining, frequent or painful urination, accidents outside the litter box, or blood-tinged urine. FLUTD may be triggered by stress-related inflammation, FIC, urinary crystals, bladder stones, infections, or urethral plugs. Because the signs look similar regardless of the cause, diagnostic testing is often needed to determine the underlying problem. While some cases are uncomfortable but manageable, others, especially urethral blockages in male cats, can rapidly become life-threatening and require immediate veterinary care.
Common signs to watch for. Straining to urinate. Your cat may posture in the litter box for a long time, push hard, or appear to struggle to pass urine. This often indicates irritation, inflammation, or a possible blockage. Frequent trips to the litter box with little or no urine. Cat may enter the litter box repeatedly, producing only a few drops, or sometimes nothing at all. This suggests the bladder is uncomfortable or obstructed. Crying or showing pain while using the litter box, vocalizing, tensing up, or appearing distressed during urination usually means the process is painful, which can be caused by inflammation, stones, or blockage. Urinating outside the litter box. Cats may urinate on soft areas like beds, rugs, or clothing when it hurts to use the litter box, associate with pain.
If your cat suddenly won't stop licking under their tail after using the litter box, their bladder is screaming for help. Cats instinctively groom areas that feel irritated, and when the bladder or urethra is inflamed, the discomfort often radiates to the genital region. You may notice your cat repeatedly stopping to lick under the tail, sometimes immediately after attempting to urinate. This behavior is the cat's way of trying to relieve burning, tingling, or painful sensations caused by inflammation, crystals, stones, or infection. Persistent licking can also lead to redness, hair loss, or moisture around the area. While grooming is normal, frequent or intense licking is a strong indicator of urinary tract irritation and should not be ignored.
My cat hid under the bed for 3 days straight, and I thought he was mad at me. Restlessness, hiding, or sudden behavior change. Cats experiencing urinary pain may become anxious or unsettled because they cannot find a comfortable position or feel constant pressure in the bladder. You might see pacing, repeated attempts to lie down and get back up, or an inability to relax. Some cats hide because they associate the discomfort with stress or confusion, or they may try to avoid the litter box out of fear that using it will hurt. Behavioral changes such as aggression, withdrawal, clinginess, or sudden avoidance of family members can also occur. These shifts often reflect significant pain or distress. In male cats, these behaviors can be an early warning sign of a developing urethral blockage.
Feline idiopathic cystitis, FIC. FIC accounts for over half of all FLUTD cases, especially in adult indoor cats. Key features include no identifiable infection or stone present, even though the bladder is inflamed. Strongly associated with stress, anxiety, and environmental triggers such as new pets, schedule changes, loud noises, conflict with other cats, or inadequate enrichment. Cats with FIC often have a sensitive stress response system, meaning emotional stress causes physical bladder inflammation. Flare-ups may come and go, sometimes resolving quickly, only to return during future stressful periods. Because FIC is chronic and stress-related, treatment focuses on pain control, stress reduction, hydration, and sometimes prescription urinary diets.
If your male cat is straining in the litter box with little or no urine, you're not overreacting by rushing to the ER. You're saving his life. Urethral blockage. A urethral blockage occurs when urine cannot exit the bladder, causing dangerous internal pressure. Important details. Most often seen in male cats whose urethras are longer and narrower. Blockages may be caused by crystals, plugs, swelling of the urethral lining, or stones. As urine backs up, the bladder becomes overfilled and toxins accumulate in the bloodstream. Without immediate treatment, this can lead to kidney failure, cardiac abnormalities, collapse, and death within 24 to 48 hours. Any male cat repeatedly entering the litter box or producing little to no urine should be considered an emergency.
Your cat's straining in the litter box isn't constipation.
It's crystals and mucus forming a plug in his urethra. Stress and dehydration trigger it. If he can't pee at all, that's a complete blockage. This is the emergency most cat owners miss until it's too late. A urethral plug is a soft, obstructive material made of minerals and mucus. They form due to inflammation within the urinary tract, which increases mucus production. Crystals present in the urine bind to this mucus, creating a plug that can lodge in the male urethra. Partial plugs may cause straining or dribbling urine. Complete plugs prevent urination altogether. Plug formation is often linked to stress, poorly concentrated urine, and dehydration. Because plugs can quickly become a blockage, they require prompt veterinary attention.
Your cat's suddenly peeing everywhere and you're blaming behavior, but majority of owners miss the real culprit. Bacteria in the bladder cause burning pain, bloody urine, and that ammonia smell that hits you across the room. Older cats and diabetics are sitting ducks. Although less common in younger cats, UTIs are an important cause of FLUTD. Bacteria enter the bladder, causing inflammation, discomfort, and sometimes blood in the urine. Older cats, cats with diabetes, renal disease, or compromised immune systems are more prone to infections. UTIs often cause frequent urination, urgency, and strong smelling or cloudy urine. Proper diagnosis requires a urine culture to identify the bacteria and select the correct antibiotic. Left untreated, UTIs can worsen or contribute to stone formation.